Patty Malloy, Public Health Coordinator with Mahaska Health, sat down with Oskaloosa News to talk about the current situation of COVID-19 and how people can best protect themselves during this time.
Yeah, we have seen an uptick, I think, starting in September. We started the month out with about 213 cases, and as of now, we're over 600. So in the last couple months, September and what we are into October, we've seen a big increase. And so at Mahaska Public Health, we get an alert for positive cases. We also are a hospital-based public health, so we also have lab that notifies us of cases that were maybe tested in our facility. So we get those a little bit sooner than other public health, but otherwise the ones tested outside of Mahaska Health will get an alert of all the positives in the county, and we give them a call. So we talk to them about their test results, and they will get a call from their providers or wherever they were tested, and they get notified. So hopefully they know before we call them, and we just talk to them about the symptoms they're having, and we do a little investigation. It can last 10 to 15, 20 minutes depending on the questions that they have. We go over symptoms, and then we also go over contacts. People they have maybe been in contact 48 hours prior to their symptoms starting, you can be spreading the COVID virus. So I think that's something that not everybody's aware of. So before you're sick, you can actually be spreading the virus, which is why, and that's the case with other viruses as well. So not knowing that you're sick at the time is just one of the things why we have a lot of the mitigation measures of social distancing, wearing your mask, and those kinds of things. So
I was going to say or ask, folks are of course concerned about this, and what kinds of steps are you guys recommending that folks personally take to help mitigate their chances of catching COVID?
Yeah, so we recommend that you wear a mask when you're out, just because that's going to help you, if you're well, stay well, and if you're having symptoms of 48 hours prior before, if you're coming down with it, it'll help the spread or decrease the spread. So we want to make sure that we're decreasing the spread and keeping those well. So masks, we have seen in different scenarios where masks weren't used and masks were used, the spread is a lot more decreased in those situations where masks were worn. So the governor did put out kind of some new guidance for Iowa that if both people are wearing masks, then that if someone comes down with COVID, they wouldn't have to quarantine the other individual. So, and we weren't seeing a lot of spread in those situations. Situations where we're seeing spread is definitely close contacts when masks aren't being worn. If you're taking a break, if you work at a facility, and lots of places are having their staff wear masks, but you go to take a break or you take lunch and you sit in the break room, you're eating, and you're not social distancing, then we see a good number of people in those situations spread. So
when you're looking at this, you're looking at the 20,000 foot level, looking down, and you're going, well, this seems to be a hot spot, or this seems to be something that is a leading contributor to the spread of COVID. When you're looking at this, is there any of that indication for you?
Yeah, I think we're seeing events, so we started getting an uptick in September. We also had some large events that have happened, that there was a large, groups of people gathering. We also started schools. We also had Labor Day weekend, and people traveled and got together and had get-togethers. So in September, that's what we were really seeing. And at this point, it just hasn't slowed down yet from that.
Okay, so basically larger gatherings of folks, as we're moving indoors, it's that time of the year, kind of being a little closer in proximity.
Yeah.
Is that what you're seeing?
Yeah, so I think if you're closer than 6 feet for the more than 15-minute rule is kind of what we go by. We're definitely seeing the spread, so people go out to eat with people, or they, are in a close group setting for meetings and not social distancing or wearing masks. Then we're seeing, small groups of outbreak spreading then to others. So.
Okay, and I know the concern, like we've expressed already, that folks have over COVID. We've talked about masks, hand sanitizer. What other kinds of mitigations can folks do to help protect themselves or their friends and neighbors, or the person that's down the room from them.
Yeah, I definitely think that if you're someone that is a high risk in the high risk population, or have a weakened immunity, some of those things, you want to definitely take care of yourself. This isn't just about ourselves anymore. We're spreading it to others, so we have population health that we need to be concerned about. But definitely take care of yourself if you are somebody that it could really be harmful and you're in that high risk category of getting really ill and being hospitalized. You want to just limit your trips to outings, grocery stores, and that type of thing, shopping. Limit those to what you have to do, or have somebody get those, or do the online shopping. We have a lot of people doing that. And then just limit who you're with. Keep your groups small. Family units, people that live in the same house. That's also where we're seeing the spread. If one person in the household is ill, then the other family members become ill. And so we do have some criteria that we say for if one person in the home is ill, isolate them, whether they can go in the basement or in their room. When they're out of that area, wear a mask, or just keep the social distancing as much as possible in a home. And I know every home situation is different, so we just kind of give the recommendations that you can do in your home. If you have a separate bathroom or something, use that. But those are kind of some of the things that we say in the homes to do.
Well, I see you have a lot of notes there, and I definitely know I haven't covered that many notes yet. So what kinds of things that you're looking at or want to share have we not touched on yet?
I think we've hit a lot of them, actually. So just limiting the contacts, the social distancing, wearing the mask, and also when you mask care is important. So masks are great, but we also want to limit the touching of your face. So I know when you wear a mask, sometimes it's uncomfortable at times. So taking mask breaks, but making sure you wash your hands or hand sanitize if you're going to remove your mask is important. And then staying home when you're ill. I don't think I hit on that yet, but if you're not feeling well or you're having some, even mild symptoms, a lot of people we hear, I just thought I had a cold. I thought I had my allergies. So if anything that's normal for you seems a little bit worse, or you've added symptoms, it's not always the cough, shortness of breath, and fever that we're seeing. We're seeing a lot of the muscle aches, headaches, runny noses, congestion. That's a big one. Loss of taste or smell. Some people, when they get to that point, I lost my taste and smell, so I figured I better come in and get tested. So testing is one thing that I wanted to hit on today too, is like when to get tested. So if you're having some of those symptoms, that I just mentioned, then, and another group of symptoms is kind of that gastrointestinal, the nausea, vomiting, diarrhea, are some symptoms that could be related to COVID. So if you're having symptoms, come to the walk-in. That's where we do a lot of the screening at our facility at Mahaska Health. They come through the screening area, and then they'll direct you to where you need to go. If it's for COVID, the walk-in providers will help you there and check you out for, not everything's COVID, so we want to make sure that we're not, missing anything, and that you're being, having a good checkup, and go over your questions and symptoms and that kind of stuff, and they'll decide whether or not you need to be tested for COVID. If you're not having symptoms and you just want to be tested, Test Iowa is a good spot to do that. I know Wapello County Public Health opened a Test Iowa site on the 14th of October. So they are open Monday, Wednesdays, Fridays from 2 to 7. And you can go online, fill out the information on Test Iowa. You have to have an appointment. And I did talk to the administrator there yesterday. She said just get an appointment, because yesterday I looked online. We were trying to get some people seen, and there were no appointments for Monday. She said go ahead and schedule an appointment. They're having some no-shows, so you can go ahead if you have an appointment like on Wednesday. Make sure you have that. It's like a barcode that it gives you for your appointment. You could be scheduled on Wednesday, but if you come on Monday, they would go ahead and test. So if all the spots are full, they actually opened up some spots so that they can have more people signed up. That way they're keeping their staff that they have set aside for that doing testing.
Okay. Anything else that we've maybe not touched on yet?
I think we've hit a lot of it. I think the testing, there's different types of testing. So what we do, we send off to the laboratory. So if somebody tests here, we do the PCR testing, which is the swab in the nose. So
We've heard lots of stories
I'm
about that
sure you
nasal
have.
swab.
Yeah, so that's the testing that goes to the state hygienic lab or our path labs. And the turnaround time, somewhere between 24 to 72 hours, I think right now. Sometimes it seems like it's a little bit longer. So once the testing gets sent there, then that's about the amount of time. So if you test in the morning, your labs will be sent out in the afternoon by a courier, and they'll go to the lab. So they get sent out at least once a day. So if you're doing it later in the afternoon, it might not get sent out to the next day. So that might be a little bit why we see some lag times in that. And then when the state hygienic lab or path labs get really busy and inundated with a lot of tests, that kind of slows things down. I know we have weekly calls. That was one thing I was going to hit on, like who are we meeting with at Public Health? We have a call weekly with the university staff and going over any situations that they have. Same with the school administrators that are here in Mahaska County. We meet with them and talk about situations and scenarios and mitigation measures and just anything that they need to ask Public Health about. So and we also have businesses call asking questions on how to kind of keep the spread down in different facilities and stuff.
What kind of resources are you telling businesses to utilize outside of your office? So the state's website, is there a good resource that folks can look at?
Yeah, the Iowa Department of Public Health has a great website dedicated to COVID. So if you go on there, Iowa Department of Public Health, go under COVID-19, and then on the sidebar you'll see different labels, and the business is under one of them, healthcare facilities and that kind of stuff. So it's kind of divided up into that. But if you can't find what you're looking for, CDC website also has a lot of good information. So we do recommend those reputable websites and not just going out there and Googling anything. So yeah, we recommend Iowa Department of Public Health, CDC are great resources. Well,
And everybody's, of course, concerned with the virus, but I think everybody looks to an end game. So at one point in time, and of course you're probably not involved directly with any sort of cure for this or a vaccine, but what sorts of things are the folks like you talking about for a vaccine or helping to be able to curb and end this, or do we see any sort of that promise in the near future?
Yeah. I mean, public health is definitely involved in an end game for sure. So we do have weekly meetings with the Iowa Department of Public Health. Dr. Padati and Dr. Garvey are, doing weekly webinars with public health, and we're talking about the Vaccine Bureau is also on our calls, and we're talking about when the vaccine is released, how we're going to set up pods to get the vaccine out to people as quickly and as soon as possible. So that is definitely happening behind the scenes too. So we're working on that.
All right. So if you're looking at vaccine numbers, how many doses will be available? What kind of people are you looking at would probably be the first recipients of the vaccine?
Yeah, we haven't got that information. That's a great question, because we ask that almost weekly too. And so there will be probably a limit on how much vaccine that we get, and they'll have a criteria. So those high-risk individuals that are most at risk when they get the virus. So those are all things that we're still working with. So. But we don't have a date, or we're hoping the end of 2020, but if that doesn't happen, hopefully the beginning of 2021.
All right. Well, one last chance. Have I missed anything, skipped anything, omitted anything that we should probably talk about?
No, I think I thank you for inviting me to do this. I think there's been lots of questions out there in the community. We're working hard at Public Health. We've added some additional staff. Some of our staff that were part-time are now working more hours. We're working a lot of extra hours and on the weekends to definitely get people called and information to those that are positive on how to stay home when you're sick. If you're getting tested, make sure that you don't go out and about till you get the results of your test, and just kind of helping them walk through the process. But yeah, thanks for having me.
Well, thanks for coming in.
Yeah.